everybody. And thanks for taking this opportunity that you all came here to attend this Medicare enrollment seminar. I'm also part of ECHO, and my name is Kapara Samuel. ECHO is Enhanced Community Through Harmonious Outreach. Before I introduce our President and CEO, Dr. Thomas Matthew, the ECHO is only 2 years old, and our mission, which will be explained and detailed by Dr. Thomas Matthew, what I understand and what I like about this organization is that this is a non-profitable organization, and what we do is we go and educate community where a lot of people are not aware of certain things, and we did couple of seminars, and I can give you which I took a lead to conduct last month was a college seminar fund where we went and we bought some experts from outside who educated parents how to get scholarship. And also with that, we also bought test takers and educated kids how to take tests. And this is what we do. We did a tax preparation seminar. We also did a cancer awareness program. So these are the things ECHO does, and we are getting known by people by doing these things. And this is our 6th one. And I want to introduce Dr. Thomas Matthew, who is the backbone actually, of this organization. And with this roaring practice, you understand he's a physician. He works almost 7 days, but he's so keen about helping our community. And Dr. Thomas Matthew took lead to conduct this Medicare enrollment seminar. And also, my mom also want to get enrolled this, and I'm not aware about this. So Dr. Thomas Matthew and Sabu is also part of ECHO, and we have Biju, he will be coming soon. So thanks once again, thank you very much for coming and attending this seminar. Dr. Thomas Matthew.
ECHO, as he already spoke to you, has been around for the last 2 years. Our mission is to educate our community, the community, to learn things which we do not get to know on a usual basis. It's not that you don't know anything, it's just that certain things in life needs experts to explain to you, and on a normal basis we do not have the capacity to go to the experts to get the knowledge. So ECHO mission basically is to enhance our communities, to learn more about things, our daily life things, which will help us to empower ourselves and our neighbors and our friends. I see a lot of faces who is familiar, I see a lot of faces which are not familiar. I guess all of you got the message from one of the medias, or from your churches or the local civic association, or from Facebook, of course from the media also. Thank you all for coming again. To start with, I just want to give you a few input into what Medicare is all about. How many of you are aware of Medicare Part C? Anybody? Medicare has 4 parts, and when I tell my patients about Medicare is an insurance which we gain by working in this country. So the minute you start getting a paycheck, you're paying tax to the federal government as Medicare tax, and once you become 65, or if you get disabled earlier, you become eligible for Medicare. And once you're 65, federal government gives you an insurance for your rest of your life. That's the savings which we accumulated over the years. So it's what we deserve to get. It's what we have to get from, because we work for it. So that becomes your primary insurance. And of course, Frank will be giving you more details on it, but it covers only 80%. That's the whole story behind the whole talk today. Part A covers hospital, fully covered, hospital admission. Frank will tell you how much is meant by full. Part B is doctor's office. And if you, some people, when they get Medicare, they see only Part B, they don't have Part A. Some people have only Part B, Part A, they don't have Part B. So pretty much all of you are aware of this Part A and Part B. There are two more parts. 2006, the prescription drug plan was introduced, and that is called Part D. Prescription drug plan, or Part D of Medicare. And then there is Part C, which is the Advantage Care Plan for Medicare, or it's called the Medicare HMOs, in which we buy into these insurances. Now, I'm not an authority to talk about it. We have an independent senior health advisor, Frank Amodio, who is very passionate about teaching this to the communities, and he does this as a job. Without further ado, let me welcome Frank Amodio to take over.
I also want to thank the group, the organization ECHO, for allowing me to come here and help educate the community about Medicare. So basically, I'm going to kind of go from A through D, piece by piece, explaining the different parts of Medicare, what Medicare covers, what they don't cover. Hopefully by the end of our session today, you guys will have a great idea or a much better understanding of how Medicare really works. So that way you guys can make an educated decision on what's best for you. You know, I always get, before I even get into it, I always get asked, so what's the best plan out there? What is the best plan out there? Well, every plan is a great plan. It's what's best for your particular needs. Everybody is a little different, and everyone's medical needs are different from the next. So, without any further ado, I'm going to kind of go through everything with Medicare. Medicare is health insurance for people that turn age 65, okay? You are eligible for Medicare as long as you've paid into the Medicare system throughout your working career. You have to work basically 10 years and pay into the system for 10 years or have 40 quarters to be eligible for Medicare, okay? Medicare Part A, there is actually 4 parts to Medicare. 2 parts Medicare administers themselves, the Centers for Medicare, and then there's 2 parts that Medicare offers to private insurers in contracts with private insurers to offer their plans to the beneficiaries. Everybody who is eligible for Medicare is considered a Medicare beneficiary. So Part A. Part A is free as long as you've paid into the system for Medicare throughout your working career. Part A is going to cover hospitals, okay? But Part A doesn't cover everything. There are some co-insurances and deductibles that come along with Part A. So Part A covers your hospitals. If God forbid you guys have to go into the hospital from day 1 through day 60, and you will have Part A, Medicare picks up all costs, except for, in 2017, $1,288. So basically, if you're in the hospital for 1 day, you'll get a bill for $1,288. If you're in the hospital for 50 days, you'll get a bill for $1,288. If you're in the hospital 61 days, from the 61st day through the 90th day, Medicare picks up all costs except for $322 per day. So, to break it down, if you're in the hospital 61 days, the bill that you will receive will be $12.88 for the first 60 days, and then you will also receive a bill for $3.22 for the 61st day. And you will pay that additional $3.22 each day until you hit day 90. On day 91, that $3.22 increases to $6.44 per day. From day 90 through 180. Okay? So, Medicare is going to cover hospitals. Day 1 through 60, $12.88. 61 through 90, $3.22. 90 and above, $6.44. Okay? Does anybody have any questions? I see you. Yes.
I have the secondary insurance, it fits all these costs?
Yes, you will be eligible to, as a consumer, to purchase plans to help pick up the costs that Medicare does not pay. And I'll get through that with you as we get a little bit further into the presentation. I'll go over all of your options that you guys will have to help supplement some of the costs.
Stand until we finish out treatment.
Yes. Okay, yes, sure. So, Medicare Part B. Medicare Part B covers your doctors. There is a cost associated with having Medicare Part B. The average cost to have Medicare Part B is roughly $120 a month. Now, some people will pay more than $120 a month, and that's based upon income. The Part B premium is based upon your income that you received the year before coming eligible for Medicare. Okay? If you are a highly compensated employee and you made over $85,000 and you filed single, you will pay a greater premium than the $120. It's roughly $120. Okay? You will pay a much higher premium. And it's based upon your income. If you file jointly and together between you and your spouse, you have an income of $170,000, you will pay a little bit higher premium for your Medicare Part B. Generally, Medicare Part B comes directly from your Social Security check. Most people elect to have it come right out of their Social Security check. You can send the check in yourself to the Centers for Medicare and to Social Security if you like to, but most people try to keep it as simple as possible. It comes directly from your Social Security check. Now, Part B, it covers your doctor visits. But Medicare only pays 80%. Your financial responsibility would be 20%. So whatever that visit is, you know you'll get a bill for 20%. Medicare is going to pay 80% of it. Okay? Any questions on Part B? Okay, this is going to go easy. Guess them together. Okay. Those are the two parts that actually Medicare themselves administer. The next two parts, Medicare contracts with private insurers. And what happens is Medicare sets the standard for the private insurers and then allows them to work with their beneficiaries. I'm going to skip over Part C for just 1 second, and I'm going to jump to Part D. Part D is the prescription portion to any kind of health care. You can purchase Part D as a standalone plan, or it can become part of Part C, which I'll explain in a minute. Part D is prescriptions, and it seems very confusing to some, but when you break it down, it's not so terrible, it's not so scary. Part D has 4 stages associated with Part D. The first stage of Part D is you have a deductible. The standard deductible for 2017 is going to be $400. Now, some plans that you can purchase have a less of a deductible. Some plans have more of a deductible. It's basically a $400 deductible. Some plans pay less. Some plans may only have deductibles for different stages. But the general basic deductible for a Part D is $400. That is stage 1. So the first time that you go to the pharmacy for the beginning of the year and you have a Part D plan, you'll pay $400 for the cost of your prescriptions. Then the plan picks up. Once you get past that stage 1, which is the deductible stage, you then have stage 2. Stage 2 is considered the benefit stage. And in the benefit stage, you will pay a co-payment per prescription, per tier that prescription falls under. Every prescription has a different tier that it falls under. There's generally 5 tiers. The first tier is what they consider preferred generics. The second tier, they consider it generic. The third tier is considered preferred brand. The fourth tier is considered brand name drugs. The fifth tier is injectables. Now, the lower the tier, the lower the copayment. A tier 1 preferred generic drug is going to cost you a lot less than a injectable or a tier 5 drug. Okay? So whenever you have prescriptions filled, I always like to tell people, when possible and when it fits your need, try to work with generic drugs. That will be the biggest savings going forward for you guys. Okay? So now you're going to pay a co-payment per prescription, per tier that prescription falls under. You will pay those co-payments until you reach $3,900 of benefit. And when I say you reach $3,900 of benefit, that means between what you pay for your co-payments and what the insurance company pays for those drugs as well. Together, once you hit $3,900, you then fall into the next stage. The next stage is what you call stage 3. Some of you guys may have heard about it, talked about it from friends. It's called the donut hole or the gap. Okay? And at that point, it seems a little scary, but what happens is at that point, once you exceed the $3,900 of expense for your prescriptions for the entire year, then at that point, you will go into the donut hole and you will pay 51% of the cost for your generic drugs, and then you will pay 40% of the cost for brand name drugs. You will also get to utilize the plan's discounted prices. So when you're in the donut hole, you're still eligible to receive the same discounted prices as if you were in the benefit stage. You're just going to pay more out of pocket for that specific drug versus when you were in the benefit stage. So 51% for generics, 40% for brand names. Okay? Once you go from $3,700 to $4,950. $4,950. Now, once you exceed $4,950 worth of prescriptions cost, then at that point you fall into the last stage, which is stage 4, which they call it catastrophic. Now, it sounds terrible and sounds scary, but in reality, catastrophic is a lot less expensive than any other benefit period. Because at that point, they feel that, the Centers for Medicare feel that you spent quite a bit of money. And then at that point, once you exceed that amount, you will pay either $3.30 for a generic drug, $8.10 for a brand name drug, or 5% of the cost. whichever is greater. Okay? That's Part D. 4 stages. First stage, just to kind of recap, because I know it's a lot of information. First stage is the deductible. It's a $400 deductible. Second stage is the benefit stage. You will pay a co-payment per prescription, per tier that those prescriptions fall under, till you hit $3,700. Once you exceed $3,700, you go into stage 3, the donut hole. You pay a larger percentage till you hit $4,950. Then you fall into stage 4, which is catastrophic, and then the costs come way down. So
Is that per year?
that's
Or
per
does it
year.
the clock start over again?
Every year, January 1, the clock starts over.
Okay.
Okay?
So by December, if you haven't hit the 3,900, January you start
You're
over?
starting all over again.
Okay.
That is correct.
Okay.
Absolutely. So basically, all you really need to cover, to help take care of the costs for your medical is Parts A, which will cover hospitals. Part B covers doctors. And Part D covers prescriptions. So technically, that's all you really need to have. You do not need to have anything else. But if you're looking for something to help subsidize the costs that Medicare does not cover, as a consumer, you have 2 options. The first option I'm going to go over is what they call Part C. Medicare calls it Part C. You guys may have seen some of the commercials on TV. They're called Medicare Advantage plans. Basically what Part C is, or a Medicare Advantage plan, once again, Medicare sets the standard for the plan and then contracts with private insurers. Different insurers. Private insurers like Empire. Private insurers like Aetna, like Fidelis, like Blue Cross Blue Shield, and United Healthcare. The list could go on and on. Part C is a combination of A, B, and D wrapped up into one plan. Okay? It's more like traditional health insurance that you may have been used to while you were in your working careers before you retired and hit 65. What do I mean by that? Well, once you have Part C, you have to, before you're eligible for Part C, you must have Part A and B to be eligible for C. Once you're eligible for C and you decide that you're going to purchase Part C, your Part C replaces original Medicare. When you have a Part C, it's like traditional health insurance. So when you go to your primary care physician, you hand your primary care physician your Medicare Part C card from whatever company it's with. Let's just say Empire for the time's sake. You go, you hand them your Medicare Advantage card, your Empire card, and you'll pay a copayment. That copayment could be $10, $15, or $20. Whatever procedures happen, you've paid your copayment, you're good. Now that primary care physician says, well, you really should go see a specialist. So he sends you to a specialist. You go to your specialist. You hand your specialist the same card. And at that point, maybe you'll pay a $40 or $45 or $50 copayment. That's your responsibility. That specialist then says, well, you need to take a prescription. He writes you out a prescription. You take your prescription and you walk to your local pharmacy, you drive to your local pharmacy, you hand the pharmacy your prescription, and you hand them that same card, that same Medicare card. The pharmacy fills the prescription. You will pay a copayment per prescription, per tier, that that prescription falls under, just like a standalone Part D plan, works exactly the same. You will pay that copayment, you take your prescription, and you go home. God forbid, later that night, you're not feeling well, and you decide to take a trip to the emergency room. You go to the emergency room. You hand the emergency room attendant or administrator the same medical card that you have. You will pay a co-payment for the emergency room visit. If you're just in and out, they bill that same card. Everything gets billed through the insurance carrier, not Medicare. Because when you have C, C replaces A, B, and D. Okay? That is what you call a Medicare Advantage plan. A Medicare Advantage plan is a, what I call pay-as-you-go type of plan, because you could purchase a Medicare Advantage plan for very low premium. You see commercials, literally the premiums are somewhere between $0 and $200, depending on the company and the plan that you choose. So the premiums are very low. There are a lot of very good plans out there that have 0 premiums. That is a Medicare Advantage plan. That's Part C. That is one option that any beneficiary could utilize to help pay for the costs. It's a low premium, pay-as-you-go type of plan. So the other option, I said there was 2 separate options that you guys could work with to help pay for your Medicare costs. The second option is you could purchase what they call a Medicare supplement plan. Now, you guys may have heard of supplement plans. There's basically about 8 to 10 different supplement plans. And what a supplement plan is, it's exactly what it sounds like. It supplements what original Medicare does not cover. Okay? With the supplement plan, it works right alongside your original Medicare. Other than the Part C, the Medicare Advantage, which replaces it, a supplement plan works with it. So in that same scenario that I just explained, when you go to your primary care physician, you're going to hand them your Medicare card, that blue and white card that hopefully says A and B on it. You hand them that card, and you also hand them your supplement card. They bill Medicare. Medicare pays 80%. Then the 20% that Medicare does not pay, they bill it to the supplement plan. And depending on the type of supplement plan that you have, it could either pay a portion of what Medicare doesn't pay, it could pay 100% of what Medicare doesn't pay. Okay? Also, I just want to kind of backtrack a little bit. I just realized that I forgot to mention something under Part B. With Part B, other than Medicare paying the 80%, you're paying 20%. The first time you utilize the doctor, you have a $166 deductible. Forgive me, I forgot to mention that before. So you would pay the first $166, and then after that, you will pay the 20%. That is every year, correct. These plans are on a yearly basis, January 1 through December 31st. Okay? That's how these type of plans work. With the supplement plan, a supplement, now to go back, okay, you have a question?
Yeah, for Part C,
Yes.
under the Advantage plan, suppose you're hospitalized, Medicare only pays the 20%, the Advantage plan pays what to the hospitalization?
Okay, when you have a Medicare Advantage plan and you have to go to the hospital,
Correct.
you will, the Medicare Advantage plan, the insurance company will pick up the costs but you will have some sort of deductible for the Medicare Advantage plan. Depending on the plan that you chose, they vary in cost. It's generally, most plans are from day 1 through day 5 or 1 through day 7. You will pay, and depending on the plan, each plan is
Yes,
different,
yes.
okay? Some plans are at $300 a day. So from day 1 through day 5, you may pay $300.
Per day?
Per day. And then after that, you pay nothing. So depending on what plan you purchase will determine what your hospital cost payment or would be, deductible, whatever that would be. Okay? So really basing it on the plan that you choose. Okay? Yes?
You explained about Medicare Part A and B.
Yes.
Whether that will pay for nursing home,
No. Nursing home? If you
adult
ha-
home,
I'm sorry?
adult home or nursing?
No. No.
Then who will pay for that?
You.
What
So
about,
what is the use of Medicare?
Medicare is for health insurance.
For what?
For in case you have to go to the doctor and you get sick and you need care. That's what Medicare will pay for. If you have to go to the hospital, that's what Medicare will pay for. They do not pay for long-term care. What you're talking about, and if you have to go, if you're elderly and you need to go into an assisted living facility, Medicare does not cover assisted living
or
facilities.
hospice?
They will cover hospice.
They will.
Yes, they cover parts of hospice, but they do not cover long-term care.
But Medicare
That's
pays
Medicare
for a
A
few
and B?
days.
A?
by
Correct.
Medicare.
A. Medicare A.
Yeah.
I'm
If you are
sorry?
referred from the hospital, Medicare will pay for 10 days or 15 days or something for a few days.
Correct, but after that, it's on you.
Then what about the Medicare Advantage? That will pay for nursing home?
No. This is strict. Nothing pays for nursing home care other than your own out-of-pocket or unless you purchased a separate nursing home or long-term care policy that you could buy
or you should
to.
have Medicaid.
I'm sorry?
Or you should have Medicaid.
Or you have Medicaid. Correct. Now, having Medicaid is a good thing if you're eligible for Medicaid.
Right.
Medicaid is insurance for
No income.
low income, underfortunate. It's not that it's bad, it's not that it's good, it's there. Centers for Medicare services and the government have things in place to help people with lower incomes. So if you're full Medicaid eligible, then yes, you would be eligible to go into a Medicaid long-term care facility. But that's completely different, and that's a conversation for basically another time.
What if someone has a chronic illness? Which one would be best for them? I know you said in the beginning that individually we, select which one would fit that
Your
person, like a
person's
cookie.
needs.
Tailored to you.
Yes.
Right. So, but say if someone has a chronic illness,
Cancer.
or say kidney problem,
Kidney failure.
like people who
With
have
dialysis.
which one would be best
Oh,
suited?
well,
For someone
once
who-
again, there are, and the doctors could probably explain this a little bit better than what I'm going to, but there are different stages of care, different stages. You mentioned cancer, so there's different stages of cancer. You could have cancer and be in remission and only visit the doctor 3 times a year. Then, at that point, it's a pay-as-you-go. A Medicare Advantage plan may be more cost-effective. It's all a matter of your particular needs and means. Some people, I have clients that go to the doctor all the time, that are very ill, and they're always in doctors and hospitals on a regular basis. Those clients, I recommend them getting into a Medicare supplement plan. Okay? Because they will pay in advance. A Medicare supplement plan is basically, like I was going to get to, Medicare supplement plan is pay in advance kind of thing, where you know that you will pay your premium for the plan and have very little to no out of pocket for your care throughout the year. One of the most popular supplement plans that are available are what they call Plan F. If you have a Plan F that you purchased, that's roughly around $270, thereabouts. You will never have any other medical costs.
$270 a month?
Roughly $270 a month.
That will
Yes.
cover,
And that's,
that will cover hospital and Part D.
It covers what a Medicare supplement plan cover. It will cover hospitals and doctors. What you also have to realize, when you go a Medicare supplement route, if that's the way you choose to go
Yeah.
for your care, you must also purchase a Part D, because a Medicare supplement plan does not include Part D. Has nothing to do with prescriptions. Only medical care, hospitals and doctors. So when you purchase a supplement plan, you must also purchase a Part D. Even if you do not take prescriptions, you want to purchase
It
a
makes sense.
Part D. The reason being, if you do not purchase a Part D plan when it first becomes eligible to you, then you will pay a 1% penalty per month for every month that you do not have a Part D plan. For example, you just turned 65 and you signed up for Medicare and you are very healthy and you don't take any prescriptions, and you happen to be 65 in January and you became eligible in January, you don't take any medications, you go a whole entire year, and then in December you get sick and now you need prescriptions. So you want to sign up for a prescription plan because no one wants to pay full cost for prescriptions. So you sign up in December for the plan to start come January. Well, you went 12 months without having coverage, and the Centers for Medicare Services will penalize you 1% for every month. So that is 12%. So you will pay 12% more for that drug plan for the rest of your life. So it's not just for 12 months you're going to pay a little extra. It's continuous for the rest of your life. So you will pay 12% more than the national average for your plan.
so you can't just, after, say, the 13th month, say, oh, you know what, I need Part D,
Well, here's another thing too.
you know?
Medicare, there are only certain times, these are all great questions.
Yeah.
There's only certain times of the year that you can sign up for Medicare. Medicare is eligible when you first become 65, or you're on Social Security disability for more than 24 months. If you're on Social Security disability for 24 continuous months, in the 25th month, you're automatically eligible for Medicare, regardless of your age. Okay? Other than that, you become eligible for Medicare at age 65, as long as you paid into the system. You have 3 months prior, the month of, and 3 months following your 65th birthday to sign up for Medicare. A plan Part A, B, and D. And I always, always recommend that you pick up a Part D, even if you do not take prescriptions. The average Part D, they vary in costs. The lowest out there today in New York is about $17 a month for 2017, and as high as $100 a month. Okay, so if you never take prescriptions, I tell you to at least buy the lowest end plan, so that way you don't get penalized if, God forbid, you need those prescriptions later on. So with the supplement plan, you also need to have a standalone drug plan to coincide with it. Yeah,
So
is
if
that,
you, so if you have Medicare supplement plan, you're saying that day 1 to 60, day 61 to 90, day 91, all is taken over by supplement plan?
yeah, depending on the plan that you purchase, there are plans from A through N, plus you have to buy a Part D, okay? Then Plan F is the most popular. That covers everything. So depending on the plan that you purchase, it will either cover 100% of the hospital, or 50% of the hospital, or 25% of the hospital, depending on the plan that you purchase.
And that's just called Plan F? That's what
Plan
it's known
F,
as?
Plan F is one of the supplement plans that are available. There are close to 8 different supplement plans that you could purchase.
Under F?
No, under a Medicare supplement policy. Plan F is just one of the 7 plans that you could choose. Okay?
Gives you the most coverage.
Gives you the
Yeah,
most coverage,
right,
yes.
right,
So it's
right,
only
right.
one of the plans. There's Plan A, B, C, F, F plus,
F plus.
N, K, yeah. There are a lot of different plans, and each plan covers something a little different. Plan F just happens to be one of the plans, and Plan F happens to be the most popular. Why is it the most popular? Because you know you could spend $270 a month, and you will never pay a coinsurance, or a copayment, or a deductible, or anything for your medical care for the rest of your life, or for as long as you have that plan.
You don't have a list of those plans, do you? A through N, whatever you say.
Sure, in your brochure, guys, what you can do, if anybody has individual needs and would like to sit down on a personal basis and go over your particular concerns or needs to see which plan is the best plan for you, then in there you'll see it's called the scope of an appointment. You could initial the first 2 boxes and then sign your name on the signature. All this form is basically giving me permission to talk to you on an individual basis about your Medicare concerns and needs. Okay? Does anybody have any questions regarding any of the parts? Yes.
You said Part C is more cost effective and cheaper compared to other parts. So why should someone go for Part A, B and D separately without taking Part C? What is the difference between these two? Or what is the benefit for Part C over Part A, B and D?
Well, Part A and B are administered through Medicare. Okay? You don't have to purchase anything other than your Part B plan, which you're going to pay a premium for, and then I'm going to tell you to buy a Plan D, which will cover prescriptions. Technically, you don't need to do anything else. That will cover your care, but you will have co-insurance and deductibles that you will have to pay throughout your year. If you're looking for something to help supplement those costs, then you have 2 options. A Medicare Advantage plan, which is a low premium option to help pay for the costs that Medicare will not cover. When you purchase a separate plan, all you're doing is looking to minimize your out-of-pocket for your care throughout the year.
So you said basically you end up in paying more money when you take Part C?
No, no. When you have a Part C, It's going to replace your original Medicare. So it's not that you pay more or you pay less. You'll actually pay less because all you're going to pay is your co-payments when you go to your doctor or your deductibles based upon whatever plan that you chose. So each plan has different costs, different deductibles. So depending on what plan you chose will determine what your costs are for the care throughout the year. But it'll be less than if you didn't have anything at all. Yes, sir.
Part C has any restrictions
Part.
when compared with Medicare?
Income restrictions?
Yes.
No. Part C, there is
Because I
no
was
income
told
restrictions.
that if we have Part C, you have to be referred by a primary physician, you can go to only in-network doctor.
Not necessarily true. When you purchase a Part C, and I'm glad you brought that up, there are two types of Part C plans that you can purchase. One of them is called an HMO. Another one is called a PPO. An HMO is what they mean, home maintenance organization. What that means is, that means you have a primary care doctor that's leading your care. You have a network of doctors that you will have to utilize, okay? And depending on the plan, a lot of plans have thousands and thousands of very good doctors that you can utilize, okay? Depending on the plan, you may, if you have an HMO, you may need to get a referral to go to a specialist. That's what a home maintenance organization plan is. It's an HMO. Health maintenance, home maintenance.
Yeah. And
Yes.
PPO is what?
A PPO is a preferred provider organization. And what that does is, that allows you to go in and out of network. If you utilize the network physicians, you will have less co-payments and less deductibles than if you were to utilize an out-of-network doctor. But once again, having a PPO gives you flexibility. I'm a big believer in flexibility, guys, especially when, you know, you're 65 and older, and the older we get, you know, our health tends to change.
Yeah.
And you kind of want to have flexibility with your options in your health care, that you want to be able to utilize any doctor that you want to utilize when you want to utilize it. If it's an out-of-network doctor, you're going to pay a little bit more. But at least you have that option to go.
What's EPO?
EPO, that's for basic individual health insurance. It's HMO on steroids, basically. EPO allows you to, you have to utilize a network of doctors, but you do not need to have referrals. So it's an HMO without referrals.
Is that under Medicare?
No. Medicare, you have either, if you're gonna purchase a supplement, an Advantage plan, you'll either purchase you'll either purchase an HMO or a PPO, okay? And there are a lot of HMOs that have zero premium. There are a few PPOs that have zero premium as well.
In Part C, if you have a Part C,
Yes,
your Part B is covered in that?
yes, that's funny, same question. Yes, so with Part C, which is a Medicare Advantage plan, it covers hospitals, which is your A.
But you have to pay more money?
No, it covers B, which is your doctors, and it covers D, which is your prescriptions. It's all in one plan. So you could have a Medicare Advantage plan that is a PPO that will cover everything. To go in and out of network if you wanted to, covers hospitals, doctors, and prescriptions. You could also purchase an HMO that will cover hospitals, doctors, and prescriptions. It's all included, one price.
If the person-
$0 to $200, depending on the plan that you pick.
If the person is taking insulin,
Okay?
such as 2 times or 3 times, so you
Okay.
suggest that you should go to the Part C or supplement.
Okay. A supplement plan does not cover prescriptions at all.
But even if you buy the
Supplement, then you could purchase a Part D plan.
Yeah.
Okay. Good question. I'm glad you brought that up. The Part C drug portion works exactly like a standalone drug plan. They work exactly the same. They have the same 4 stages: deductible, premium stage or benefit stage, donut hole, catastrophic. Works exactly the same. The only differences between a standalone drug plan and a Part C drug plan is the deductible. Some plans have a low deductible. Some plans have no deductible. Some plans have only deductible for stage 3, 4, and 5, not for prescriptions in tier 1 or 2, only in tier 3, 4, or 5. Those are the only differences between the different supplement plan, the different Medicare Advantage plans. But the prescription part's all exactly the same.
At the same time, one more question on that. If you buy a part, A, B, C, D, N, example N,
I'm sorry?
there are many
Many different supplement
supplements.
plans.
That is, you said that F, N and all.
You're right, there's
Is the person-
8 of them.
The person who bought N,
Okay? N, plan N.
plan N.
Okay.
and, why that insulin co-payment was 600, 700.
Okay. The insulin copayment has nothing to do with your Plan N. Your Plan N is a supplement plan. Plan N only covers, or any supplement plan only covers doctors and hospitals. What the higher cost for the insulin is the fact that it's part of your Part D plan, and depending on the type of prescription or the type of medication, it's either going to fall into one of the 5 tiers. And the higher the tier, the higher the cost, unfortunately. Yes.
You should mention Epic to him.
Yes. Okay. Thank you. We live in a great state that if people need help with their prescription costs, if people need help with their Part B premium, okay, you can call up the Centers for Medicare, Social Security, all right, and they have lots of programs to help defray some of those costs. There's also another program in the state, it's called EPIC, which is a plan that it's based with the state. It's based upon income levels, and if you're eligible for it, what EPIC does is it actually helps to pay for the costs of drugs while you're in the donut hole. So if you happen to take a lot of drugs and you find yourself falling into the donut hole very early on, then basing it upon your income levels, you could always apply to EPIC. For example, my mom, she's on 30 different drugs, and that's no exaggeration. She's got pill containers all over that she has to take 3 times a day. She falls into the donut hole in like May. So she goes through her $3,700 worth of prescriptions, and then she's in the donut hole very early on. If you're eligible for EPIC and you apply to EPIC, then that helps pay for the costs while you're in the donut hole. Yes, sir.
Can you elaborate the special enrollment period?
Okay.
Because I'm working still, but I was eligible in a couple of years ago. And if I have to pay the penalty if I apply this special.
Okay, so here's how this works. If you continuously work or you have credible coverage, then you're not under
Penalty.
the penalty. Correct. You have to have credible coverage. A special enrollment period, so like I had said a little bit earlier, there's basically, when you turn 65, you have the 7 months to enroll, okay? Then once a year, Medicare from October 14th through December 7th allows you to review your health coverage for the year that just passed and allows you to make changes if you feel necessary. And I always tell a lot of my clients, all of my clients, you want to review your coverage from year to year, because what plans are available this year could be different than the plans that are available next year. Okay? The plans that are available next year may not be there the year after. Companies come in and out. Plans change. Premiums change for the plans. Co-payments change for the plans.
Particularly prescription this year.
Yeah,
Big
and
change.
prescriptions, yes, absolutely, and prescriptions. So it's really based upon your particular needs. So I always tell people you have that time frame to review your coverage. You also have a special election period. There are a lot of different special election periods. The most common are if you had credible coverage and you lost credible coverage, now you have a special election because you lost coverage. You moved from one city to the next, and the city that you lived in had a particular plan, but now the new city that you live in doesn't have that plan. Plans vary from state to state, from county to county, okay? From borough to borough. So there could be one plan in Nassau, but not in Suffolk. There could be a plan in Suffolk, but not in Nassau. There could be a plan in the Bronx that's not in Nassau or Suffolk. So it's really based upon where you live. So that's also a special election period if you happen to move. So there's lots of different special election periods that could come throughout any time of the year, basing it upon your particular situation.
Suppose it is in March 31st, and when I'm planning to retire, then when I have to apply for this Part B?
Okay, so you currently work and you have health coverage through your employer?
Yes.
Okay. And when you're ready to retire, are you does your employer offer you a retirement package that gives you health insurance?
No, after retirement, nothing.
You get nothing.
Nothing.
Then the day that you know that you're going to retire is the day that you want your plan to start. So if you're going to retire March 31st, then your coverage is going to end on March 31st, then you want your health plan to start April 1st.
So after the
So
retirement, we have to go to the Medicare Part.
I wouldn't wait.
Yes.
If you know that you're going to retire in March,
Yeah.
at the end of March, I would sit down with somebody like myself in the beginning of March to go over your needs. Absolutely.
When you
If the
retire,
employer continue this coverage, then what do you do?
I'm sorry?
The employer continue this coverage.
Does your employer continue the coverage?
Yes.
It depends on your employer.
If the employer.
Oh, if your employer gives you a health insurance plan,
Supplement.
part of your retirement package,
Yes.
then you don't have to do anything. As long as that coverage is considered credible coverage, you do not need to do anything. What's that? Yeah, but you automatically, at age 65, you automatically get enrolled into Medicare Part A as you turn 65. So technically, if you have coverage, you don't need to do anything else. If you have a prescription plan, you do not need it as long as it's credible coverage. I always tell people, take Part B though right away. Yes, sir.
The question of coverage, A, B or C will cover ambulance.
good question.
Good question. It's under B. It's under B. C is A, B, and D. So if you're asking me, do you have a C plan?
I have to see through the employer.
You have C through an employer? Then C is going to cover your ambulance. Remember, when you have C, C replaces A and B and D. So whenever you have C, C trumps everything.
But in my case, Medicare pays a part of ambulance, balance, if any, my secondary will pay.
It depends on the company that you work for, how many employees are part of the company. Some are Medicare first, supplement second. Some are supplement first, Medicare second. So depending on your plan, your company, how many employees there are, that will determine which plan pays first. But if you have C, and it's not part of an employer, C pays everything. C covers everything It replaces A, B, and D. It's a little separate, a little different when you are part of an employer plan.
When compare the monthly premium, A, B, or C, which is better? Profitable for the patient.
What's better for the patient is the plan that is going to cover that patient's particular needs and concerns. There is no better. See, you're trying to compare A, B, and C and D. They're not all separate plans. A and B is Medicare. That's what you get from paying into the system. A is free, B you're going to pay a premium. You don't need to do anything else. But if you chose to do something else, if you decide to go with the plan C, which is a Medicare Advantage plan, then that covers everything. It replaces A, B, and D.
Well, they make you take A and B.
Yes, you have to have A and B to be eligible for C. You cannot have C with only having A. You need A and B to be eligible for C. Any other questions? Sure.
Other than Epic, is there any plan which will cover the donut?
Any plans that cover the donut hole? Yes, there are some Medicare Advantage plans that give you some coverage in the donut hole. For prescriptions that are in tier 1 and 2. So some plans, depending on the plan that you choose, gives some protection for tier 1 and tier 2 drugs. Depends on the plan. I haven't seen a plan, and I represent most carriers on Long Island.
Epic helps a lot.
Yeah, Epic helps. Epic is great, guys, to sign up for Epic. It's a one-page application. I recommend everybody sign up for it. Even if you don't think you're eligible, sign up. Because the worst they're going to tell you is no, you're not eligible. But don't ever think, because the income levels change from year to year.
And they raise them a lot.
And that is absolutely correct. They raised the income levels a tremendous amount going into 2017. And when you apply for Epic, it also gives you a special election period too.
Question.
So you could use Epic, apply in March. And then once you apply in March for Epic, then you're eligible for a special election period if you want to sign up for another plan.
Home health aides is not covered under any of the parts.
Home health aides, if it's a Medicare approved care, then it'll be covered under either A, B, depending on, do you have a supplement plan or do you have a Medicare Advantage plan? So if you have a Medicare Advantage plan, if it's a Medicare approved, they'll cover some, depending on the Advantage plan that you have. Any other questions?
If you signed up for Part C, can you change from a HMO to a PPO if you don't like the HMO?
Yes, you have two things that you could do. You could change during the annual election period, which is called the AEP, which is going on right now. You could change plans. You could go from an HMO to a PPO. Anywhere from October 14th, October 15th through December 7th to change for January 1. You also have a disenrollment period, January 1 through February 14th. At that point, if you chose a Medicare Advantage plan that you're not happy with, you can disenroll from that Medicare Advantage plan between January 1 and February 14th. When you disenroll from that Medicare Advantage plan, it gives you a one-time option at that same time to purchase a Part D plan. Because when you get rid of a Medicare Advantage, you lose your prescription. So it allows you to purchase a Part D, but it will not allow you to purchase another Medicare Advantage plan. Okay, so you can disenroll outside of the annual enrollment, which would be, the annual enrollment is October 15th through December 7th. The disenrollment period is January 1st through February 14th. You can disenroll, but then you're only eligible to purchase a Part D standalone drug plan.
But during that disenrollment time, can you change to some other plan?
Not a Medicare Advantage plan.
No.
No, but you can, at any time of the year, purchase a Medicare supplement plan. So there is no enrollment time frame if you want to purchase a supplement plan.
No, once you finish the presentation.
Yeah, just answer questions.
Oh, okay. Some people are late, you can just review one.
Okay. Does anybody else have any other questions?
Any supplements plan has any waiting period?
I'm sorry?
Supplement plans,
Yes.
once it is covered, it will be effective after a certain date, waiting period?
No, as long as you've had credible coverage prior, there is no waiting period. Once you sign up, you wanted to, you sign up on May 5th, you wanted to come eligible June 1st, they start at the first of the month. Every plan starts at the first of the month. Doesn't start halfway through the month. So every plan will start at the beginning of the month.
Where can you find listings of the supplement plans?
You can contact somebody like myself. You can call up Centers for Medicare. There's a book. I have it. Hold on.
If you want to know A to N, it's in your social
Where did I leave it? I
security
just-
book
So?
that you get Medicaid.
No.
If you need to know the prices, you have to call High Capital.
Hold on 1 second. This is a book that everyone is eligible to get. It's called Medicare and You 2017. In the back of the book, it gives you all the plans that are available. It explains who's eligible, what's eligible. Pretty much everything that I just said to you guys is in the book. Where I get my material from, I get it from the book. So, every year. And like I said, if anybody has particular needs, what I recommend is always, if you're looking for a plan, if you're thinking about going the Medicare Advantage way, I always recommend have the person that you're working with run your doctors. Okay, there is a database that you can go on. You guys can go on yourself, Centers for Medicare.gov. Okay, and it gives you all the plans. You can put your doctors in, and it'll tell you what plans your doctors belong to. Okay, that's something that I do for all of my clients, my beneficiaries of Medicare. I run their doctors every year through different plans to see what plans they have. Run their prescription costs too, their type of prescriptions that they take, the dosages, because it kind of spits out and lets you know exactly what the costs are going to be on an individual basis. Any other questions?
Where do you get this book?
Centers for Medicare, when you turn 65.
Yeah.
They mail it to you. Once, yeah,
Yeah.
everyone gets it every year when you turn 65. Yeah, and if you're on Medicare, you get the book every year. So,
I'm
They
asking
sent
it
it out
for,
already.
I'm asking it for you.
okay, yeah, actually, I don't get the book. This is my mother's book. Okay? Really, it's my mother's book. I took her book. I take it every year. She's the one that got me started in Medicare. bunch of years ago, my mom was eligible for Medicare, and I've been in the insurance business my whole entire career, 20 years, and
It could be
she
confounding.
she got it, and I never did Medicare before.
Confusing.
Yeah, I never did
When
it
I heard the
before.
word, I would just turn away.
Absolutely.
But now you made it very clear.
Yeah, I never did it before, and then she asked me, she says, here, you're the insurance person in the family? She dropped everything on my lap and said, you're the insurance brain, figure it out. And I did. And as I was figuring it out, I said, you know what? I might as well get licensed for it.
Right.
I did. And I've been helping people ever since.
See, there are two categories of retirees. As you go on from your employer, like MTA, those employees give you insurance for life. So their part is very easy, because all they have to do is, once they retire, they get Medicare. All you have to do is just carry on with the Medicare. That's your primary. Secondary insurance is your insurance, which MTA gave you. The other group of employees are the ones who get stuck with a lot of issues. And when you hear these donuts and all that stuff, it's all for them. It's a headache, it's heavy. We see it all the time, we feel the pain, we know how it goes through. It is heavy and it's a toll on them. After $3,900, if you're on insulin, $3,900 is nothing. In 3 months you're done. For 4 months you're done. So the rest of the months you have to pay for insulin. It's too much. And you worked for 65 years and this is what you're getting. So that's the frustration. So Epic is the way to go. Epic, everybody should apply for Epic, whatever he said. And they are the ones, those people are the ones actually who should really look into something like the Advantage Plan. And when most people, when they go for an Advantage Plan, what happens is they pick up the ones which gives you $100 of soap and the combs and all those things. Don't choose that.
Yeah.
Because they catch you somewhere else.
Yeah.
The plan which you should choose is the F plan. The plan, that's a supplement plan. The plan you should choose is the one which you have a little bit extra premium. Maybe it's $250, but that will cover you through everything. And then apply for Epic. So that's the decision which you have to, and again, if you made a mistake this year, you can correct it next year. It's not the end of the
The
world.
best thing is check with the doctor before signing for the insurance.
Excuse me?
Check with the doctor.
No, the doctor
Before
does
signing.
no, the doctor does not know.
Yeah.
Doctor is not aware of it.
That's another thing.
Doctors don't know. I'm telling you, doctors
I agree.
know least about these things.
Right.
I mean, I cannot do a presentation what he did.
No. On the basis of the particular patient, you know which insurance is better for him.
No, but
because of his multiple medical
No,
problems.
that responsibility you should take because you know what you're taking.
Right.
Nobody else knows it.
You know your
So now,
pocket.
in this day and age, if you go online and check your particular insurance for the next year, you can look at the medications which they cover.
Right.
You can match it up with what you know. You can ask the doctor, can I go with this kind of insulin versus the other kind of insulin? Because that insulin is covered under my plan. There is so many variables to it and it's so headache. And I see it every day, the pain in you. I see every single day what goes through this. And that's why we had to bring him up here. You have more questions, please don't forget to ask before you leave. One more thing I want you to do, there is a sign-in sheet for ECHO. Please put your names in. So when we do it again next year, we can send you the email so that we can communicate with you.
We are in the same organization, and he is in this people service section almost 20 years. And I know he is helping a lot of family, and like he said about his mother, he started his career from that position to help from his family. So he considers everybody as a family. This is a very, very complicated issues. This is not easy to understand in 1 hour or 2 hours. You really need somebody like a very specialist in this scenario to help you, to give you an advice. What is the best options for you? That is very important. Like he said about A, B, C, D, E, F, G, H, I, whatever it is. Even I cannot understand everything. But we need some specialist to help you. That is why we brought him here and his great presentation. He is working with the FDNY and Columbia Association, and he is the part of the Dixie community group, and he and his beautiful wife, Carol, right?
Yes.
Yes, okay. And they are helping our family. So he is first time in our community
Yes.
also. And
Thank
so please use him to get help from our community. That is very important factor. Second thing I want to mention, the ECHO doing this type of program, the reason is this is not anything for our personal benefit or anything. This is really, we are spending our time, effort and everything, only one motive, to help you, to help our community, educate them, take a valuable decision with a very informative way. Dr. Matthew opened this, this facility, something like this much crowd here. It's not easy, understand, this is an office, it's not supposed to like this, but he made it for us.
Yes.
So he loves our community. We're very thankful to Dr. Matthew to make it. This is second thing, we did one cancer awareness program. It was a great effort. I don't know how many people use from our community, but it was almost 10 doctors attend that program. So we spent almost 3,000. It's not the money thing, $3,000, $4,000, but I don't know how many people use it. Please use this opportunity to have something for our community. You can also help us, not in a financial way, we are not asking for anything, but please spread this news to your brothers and sisters and your neighbors and other community members. That is the way, when we are doing this type of program, our community can get all the help and support. So here, in his folder, you can see the consent form, because the Medicare and Medicaid is a very, very regulatory industry, right?
Yes.
Very, very regulated. So to do this one, he took a special sanction, right?
Yes.
Okay, then only he can do this one. We are not supposed to ask anything. So you have to fill up that form and you can give it to him. Then he can call you both and communicate. That's up to you. And that is the way he can try to help. Because the reason we brought him, this is not the easy subject. It's a very delicate subject. Nobody can explain everything. But he's a very informative guy. Last 20 years, he's working in this field. So that is where we need to help. And somebody asked about the long-term care things. A lot of people, they are thinking health insurance will cover the nursing home and assisted living facility. No, that is the wrong concept in our community. That is an entirely different concept we are talking about it. A lot of people are thinking like that too. Even uncle, when I ask, I am surprised to hear that one, because that is the way our people are thinking, oh, health insurance will cover everything. It's not the real fact. The reality is entirely different section. That's why our community has to educate about this one. Especially our community is a middle class people. Most of the people, they have a nice job, they had a nice job, and they have a good social security, they have a nice pension, they have a nice 401k, they have a nice house, they have asset and everything. This is very dangerous. If you want to keep everything in your own way, you need to have a plan. Otherwise, government is looking for you. They need money. They have to spend for everything. So that is why if you don't have a proper plan and strategy to protect those type of things, like whatever he is explaining, then it will be very dangerous, because whatever you made last 20, 30 years, our calculation, the husband and wife has to spend at least $250,000 in their lifetime after retirement for this type of insurance and long-term care cost. That's the money has to come out of you. If you don't have a proper plan, it's a very dangerous issue. So that's why I'm trying to, our organization trying to help you. We did cancer awareness, tax planning, estate planning, and kids education, how they can get the admission for the good college. how they can prepare for the SAT and all the exam. We are doing every time, every 2 months we are doing. It's a lot of effort from our side. Please use this one and use all the community.
Employer health insurance, retirement employer health insurance, what kind of Medicare you can apply? Part A or Part B?
If, the question is, if you have health coverage through your employer,
Yes.
what should you get when you turn 65? Minimum, you should get A. I recommend you get B as well. That way, you'll pay a premium for your B, but that way, whatever your Medicare don't pay, depending on your employer, how many employees you have, does Medicare pay first or second?
How much is the premium about
For what?
B?
For Part B, the average premium is about $120 a month. The average. If you are highly compensated and you make more than $85,000, then at that point you will pay a higher Part B cost. It's based upon what your income levels are. In this little brochure, most of you have it, I believe all of you have it. In the back page, it kind of tells you your limits. From 85,000 to 107,000 for a single, you're going to pay $171 a month. Under 85,000, you're going to pay $120. From 85 to 107, you're going to pay $171. From 107 to 160, you're going to pay $243. So it's all based upon what your income is. To get exact numbers, once you apply, when you turn 65, you call up the Social Security Department, you go down to Social Security, you apply for your Medicare Part A, you apply for your B, you apply for your Social Security benefits, they'll let you know what your cost is based upon what your income level
That's
is.
the individual income or the family income?
Individual and family.
So the
So
couple will
individual,
pay, the couple will pay the same thing that a single
no,
person?
it's the income if you file single or file jointly as a couple. Medicare is an individual thing, okay? So it's not, your Part B is not $120 for you and your husband. It's $120 just for you. Medicare is individual. It is not a family plan. But when they come up with the price for your Part B premium, it's based upon your income and how you filed. If you file single, it's under 85,000. If you file jointly, it's under 170,000, where you will pay roughly $120. If you file single and you make more than 85,000, up to 107, or if you file jointly, 170 to 214, then you're going to pay $171. Okay? So it's always on an individual basis alone, never together with your spouse. Most traditional health insurance are family plans, husband-wife, children. Medicare is different. It's for an individual.
So if you get the supplement, you'll pay that 171 plus what the supplement will require?
Well, you would pay 171 if your income level is over 85,000.
Right.
Okay? So then your
And then I
Part B.
choose a supplement.
Correct. Then you
Then I
will,
have to pay that premium also.
that is correct. You will always, whenever you're looking at either a Part C plan or a supplement plan, you will always still pay your Part B premium.
Right, okay.
That never goes away. You will always pay your Part B premium. It's a supplement in addition, there'll be a cost, or a Part C plan which will replace A and B, but you will still pay your Part B premium when you have a Part C.
What do I check off for supplement?
Hi, those of you who don't know me, I'm Diju. I'm one of the members of ECHO. We're working along with Dr. Matthew, Sabu, and Samuel. I'm here to just convey a word of thanks for all the participants here today. Hope you taking back something useful, learn about Medicare, the ABCs of Medicare. So this is one of our first initiatives that we did this year with the help of Dr. Matthew and Sabu to enroll such a nice Medicare enrollment program. In future also we continue to do this program. This won't be stopping right here today. Along the same lines, next year we'll be back here again doing something more interesting. Okay, I will also make an announcement, as Frank said, please make sure everybody got a package, I believe. In the package there is this form called Scope of Sales Appointment. Due to regulatory conditions or policies, we are supposed to get this filled out. Only then Frank is able to sit with you one-on-one to talk to you on this. And once again, I wholeheartedly thank on behalf of ECHO for all those who participated today.